At Riverside, we have both anatomic and reverse total shoulder replacement, which should take care of all of the needs for a patient who has arthritis within their shoulder or limitation due to long-term loss of rotator cuff function. The anatomic shoulder will allow a patient full range of motion and use of the shoulder and excellent pain relief. The reverse total shoulder we use for patients who no longer have a rotator cuff and they have limited range of motion to start with, like maybe they can't touch the top of their head, and afterwards they could touch the top of their head or even reach to the second level of the cabinet. At Riverside Walter Reed, we use an anterior or deltopectoral approach for the reverse replacement. No cement is used, everything is press fit. We remove the patient's arthritic portions of the joint and replace it with metal on both sides and a plastic bearing in between. The procedure takes about 30 minutes to an hour. The bones are removed and a new joint is made. You will stay in the hospital one night for antibiotics and pain control, and following that you'll be in a sling and go to physical therapy. It's really tremendous what the reverse total shoulder replacement has allowed us to do for our patients here, and I'm happy that I have the skill to provide it to them.